Hi, good afternoon. Thank you for joining us this afternoon. I was asked to talk about the topic detecting mental illness and seeking help. So I realized there's quite a good deal of slides. I may actually focus on certain key areas, how to recognize mental illness and how to do good self-care. And finally, when things don't go right, how to seek help when we need it. So I want to start by asking a question. How common are mental illnesses? So if you look at the two Singapore mental health studies done in 2010 and 2016, it's actually not that uncommon. For major depressive disorder, 6.3% of the population can be afflicted by that at some point in their lives. And that's a lot. If you add together all the other lifetime prevalences, this is actually something that we may expect to see either in ourselves or in those around us. But the good news is that most of these conditions have effective treatment, and there are ways of making the conditions more bearable and be the most functional that we can be. And this is the purpose of today's talk, really. So why is it important to get help? The concept of burden of disease, okay, at least the one that WHO came up, this was actually a methodology developed by Harvard University and WHO for the World Bank, when they try to measure how much impact common diseases have on our lives. They look at two things. One of them is the years of life lost or premature mortality. Like if you had a condition, you may find that some of them have actually a shorter lifespan compared to the rest. And the next concept is the years of life lost due to living in poor health. So think about the poor productivity, being estranged from family, isolating ourselves, being unable to go to work or participate in the activities we enjoy, or being a part of community. So these are as if that even though we are there, either at work or in the midst of social gatherings or in our families, we are not really there to enjoy what maybe could have been a good and purposeful life. So if one daily represents the loss of equivalent of 1 full years of health, you can see the impact in the next few slides. For major depressive disorder, it actually ranked number 11. This is a study actually from a review article in New England Journal of Medicine in 2013. The disability adjusted life years is compared between two kind of time spans, 1990 and later a more recent study. It's actually not insignificant, and it ranks pretty high if you think about all the other conditions, physical illnesses we commonly thought are very serious and something that needs to be treated. So it's something that not to be trifled with or not to be ignored. If you compare the differences between countries, among the lower income countries, middle income, and the high income countries, in which Singapore would have belonged to the high income countries, you find that conditions like depressive disorder actually rank pretty high, because other conditions such as diarrhea diseases, prematurity, and low weight obviously has a lower incidence in this kind of settings. So it becomes a more of an issue. If you look at one country that is probably could be more similar to our setting, and in this case is the United States, major depressive disorder, you can actually look at the disability adjusted life years, the dailies. It is very high. And the good news, as I said earlier on, is that if recognized early, somebody who goes through that don't have to live longer in distress, and there are many effective treatments. So I want to start with asking, what is normal? When we say we are normal in terms of mental health, it is really four big domains. What we see and hear, how we perceive around us, what we think, our patterns of thinking, and how we feel, our emotional control, sadness, anger, disappointment, happiness, elation, all these are normal emotions in the right doses. Okay, but sometimes it can go very, very wrong, and we need to recognize that. Finally, it's the self-control, the impulsivity that comes with it. Impulsivity as in making the wrong choices. Some people turn to alcohol as kind of self-medication in the wrong way. Some people do something very drastic to hurt themselves or harm themselves. So in most of us, we have our way of regulation. When we recognize that, what we tend to perceive the world in kind of overly dark tones, we cannot self-correct. We can do things that are helpful, like indulging in hobbies, being with friends, or doing something else to distract ourselves. But in some people, they find it very, very difficult. When it becomes an illness, it is really a combination of three areas. There is a set of symptoms that comes together. In depression, for example, I will go through some of the symptoms that a person invariably experiences or other people notices about them. So they have to be all this together in the same period of time for a prolonged period. So somebody who is sad or anger or feeling angry or all this out of sorts for a couple of moments in the day doesn't really count as mental illness. In addition, when people are ill, they are distressed, they're very unwell, they feel sick, they're able to carry on in their functioning. That's the third area. They can't go to work, they can't participate in relationships, they can't do the things that they like. And to them, it is this can be the biggest blow because they don't feel like they belong, they feel very much alone at a time when they probably most needed the help from others. So this is just a slide about relativity. So in the cartoon, the person says that I'm very, very happy, but I want to be very, very, very happy, and that's why I'm miserable. Sometimes it's a matter of perspective, what we expect. And when that level of expectation is way beyond what the actual situation we find ourselves in, there can be a kind of disconnect, makes us uneasy, makes us upset. So what do you do about it? In mental health, we rely on classification systems. So you often hear the terms major depressive disorder, bipolar disorder, schizophrenia. These are actually from two main classification systems, which we call DSM-5 and ICD-10. One of them is American-based, the other one is by the WHO. I can't go through all the conditions in mental health in this setting, but I'm just going to at least want to give you an understanding of what the key presentations of each of these conditions. Let's start by schizophrenia. The condition is schizophrenia. So you may have seen the movie A Beautiful Mind, Professor John Nash, who gradually finds himself grappling with symptoms of psychosis and how he tried to turn his life around. It's not easy. So in this condition, schizophrenia, there are symptoms such as hearing voices that are not there, or they may see things that are not there. It's actually more of the brain neurotransmitters going haywire, and this affects how they see and hear. Remember the four domains of thinking that I spoke about, what is normal. It also affects the way they think about they interpret the situations around them. The emotions are obviously affected. Generally, the themes of these experiences are negative. People are out to harm them. There are people who are spying on them. It's very frightened. They're distressed. And the ability to regulate themselves, the self-control is obviously affected. So these are what we call, we divide them into positive symptoms. If they hear voices, if they have disordered thinking process, sentences doesn't make sense. So one sentence has no relation to the next. Sometimes they are what we call negative symptoms, which is conditions like withdrawing from the world, the lack of motivation, amotivation, not talking much. So everything is kind of toned down or even absent. Socialization is gone. a lot of ambivalence about what to do next. So this, as you can imagine, the positive and negative symptoms can have a lot of destructive effects on their life functioning, wherever they are, either schooling or working. So when we talk about psychotic disorders, we have to consider what we can do to reduce the relapse. This tends to be a lifelong condition, but there are ways to make sure that the relapses don't occur as frequently or at all. Sometimes it may be an issue of dangerousness, either to themselves or to others because of the disordered thinking process. But you can imagine, because it's so distressful, sometimes there are a lot of thoughts about people harming me. I just don't want to carry on with that or do something to hurt myself. This can sometimes be common in extreme cases. But there is also a prodromal phase, which is why we hope to educate the public and to screen and to make sure that those who start to develop the symptoms get the treatment early. There is a concept called duration of untreated psychosis, where if someone with schizophrenia got treated early, the prognosis over the years is much, much better. They don't get as impaired in their functioning as the disease progresses. Each time they had the relapse, the functioning doesn't really return to where they are before the illness struck. And we can actually see some of these individuals living very productive life in working and in family relationships. Of course, we try to reduce the risk of suicide when it happens. So I just spoke about prodromal syndrome. I'm just going to touch on this briefly. When things start to go wrong, a person feels very unwell and easy, so there may be anxiety or depressive symptoms. They can't concentrate that well, and they have impairments in their memory. Their performance overall is affected. They feel different from others. They feel that things in the environment are different, somehow changed, and they are isolated, more and more isolated. They don't have the interest that they used to have, and there are a lot of preoccupation, a lot of in thoughts mainly. They're very preoccupied and hard to engage. Next, I want to talk about depression. You may recognize Virginia Woolf, a writer who had this condition, who struggled with it for much of her life. So in mood disorders, there's two big classes. One of them is depressive disorder, where the mood is persistently low for periods. The condition bipolar disorder is someone who has a depressive episode or episodes, but at other times they may have the opposite of depression. So the mood just goes from a fixed low mood, they recover. The next time around, they may have a very fixed high mood, but the high mood itself is destructive in some ways because they are having problems sleeping, they make rash decisions, they don't focus that well, so everything seems to be impaired. Even though they say, I feel happy, sometimes they even got too happy that they become irritable instead, and then it goes to the arguments and fights, or they make decisions that they regret very much, like making big purchases, short-term relationships, turning to alcohol and drinking a lot. And just very briefly, I talked about intellectual disability. We group it under mental health conditions. There are different grades. IQ tests might show that they are either having mild intellectual disability, moderate, or severe. For some of them, they may struggle with intellectual disability, but they may not look that different from the rest. So it's not just saying that, oh, he looks okay, so that his IQ must be all right. You find that they tend to struggle more than the rest, because for those with a good IQ and able to function well, they have a lot of recourses when things go wrong. There are a lot of coping mechanisms. They tend to have better social networks to turn to. But people with ID may struggle, they can't cope, and we may easily lead astray by negative influences. Sometimes with the simplest tasks, they may feel very stressed out easily. So because in DSM and ICD, we also classify substance use disorders as mental health conditions. Because of the impact it has on our mental health and the ability to function, when we took too much of the drug, which is addictive. There are a set of behavioral problems or memory cognitive problems that can arise. There will be relationships that will affect a lot. Most of the time is spent either looking for the drugs or recovering from the effects of drugs. They can't function that well. It leads to conflicts either at home or at work. And at times, even during the course of ingesting the drugs, they may have a set of behavioral symptoms, disruptive behaviors that led into trouble and risk of self-harm. And then there's anxiety disorders. So I want to make the distinction that anxiety is actually normal in all of us. It has a purpose. At small amounts, it actually reminds us to do what we need to remember to do quickly, or to work faster, or to work harder, because the timeline is approaching. It is kind of a built-in warning device. Moderate levels of anxiety can actually make performance better. Like if you think you are primed because the exam is just 2 weeks later, and this is really important to you, you obviously be very focused in trying to do as much as you can before the deadline approaches. But sorry, part of this is hidden. But at very high levels of anxiety, it can lead to paradoxically an impairment in your functioning, because all you think about is just approaching deadline, and you can't remember, you can't focus, you can't plan, you're just kind of stuck in indecisiveness, in a panic mode. So basically, the symptoms of anxiety can be divided into 3 domains. There are certain symptoms that we experience. The heart is pounding, you're short of breath, you're dizzy, you have a lot of sweating, particularly on the palms. Sometimes people have headache, they have dry mouth, they have abdominal discomfort, they feel nausea, muscle aches and pains. Because imagine this is like having a motor running inside non-stop. So you can't rest, you can't relax, you feel tired easily. The other side of it is psychological. There's an excessive worry, get irritable very easily, impatient. You feel tired physically and emotionally, your mind is racing, usually thinking about things that you don't need to think about. There's a lot of difficulty concentrating because you can't focus, you can't decide that well, take a long time to make decisions, you can't remember things. So memory is interesting. So in order to remember well, we have to stay focused on something while the encoding, the memory is being laid down in our brain, and stay focused again as we try to retrieve the memory the next time. So when it's affected, like condition and anxiety, it's obviously a lot of problems. Finally, there's a set of behavioral problems or symptoms that can arise. People tend to be very obsessional in being perfectionist, overly so, sometimes being very particular about cleanliness, about order. When they're anxious, they may have a lot of anxiety about certain situations. We call it phobias, specific phobias, or they may avoid situations altogether, like speaking in public, being with others, being in enclosed spaces make them very anxious, and they feel very distressed if they are exposed to this. So these are just some of the terms I'm just going to run through very quickly. We have many names of different conditions: adjustment disorder, when there's a stressor in our lives and feel so anxious, depressed, or behavioral symptoms. We have general anxiety disorder, phobias, panic disorder, OCD may be classified differently now, obsessive compulsive disorder, and post-traumatic stress. Personality disorders, sometimes we talk about it. In some people, they have an enduring pattern of how they see the world and how they behave with regards to interacting with others. That begins very early, and it leads to kind of dysfunction in the relationships. Okay, sometimes anger, sometimes irritability, sometimes impulsivity, sometimes social isolation as well. And we have other conditions, childhood, that can arise in childhood: attention deficit, hyperactive disorder, conduct disorder, autistic spectrum disorder, dementia in elderly, and sometimes medical conditions can be associated with psychiatric symptoms, particularly the chronic physical conditions like rheumatoid arthritis that cause a lot of persistent pain, the condition, physical illnesses that has impact, very big impact on mortality, like cancers, and so on. So I'm going to focus a little bit more on major depressive disorder, because as you see just now, it does have a lot of impact on our mortality and our functioning, so disability adjusted life years. And to go through a little bit more in detail, if you have the time, it might be quite worthwhile to watch this short cartoon by the WHO. It's kind of put it in a story format. And once you've seen it, it helps you to remember very well what the symptoms. You can relate to that very easily. And the symptoms, as what I'm trying to describe to you in subsequent slides. It is you just Google search, I had a black dog, and it's on YouTube. So to start off, in depression, we know that the mood is low. So depressed mood for most of the day, almost every day, for a sustained period of 2 weeks or more. Okay, obviously, this is not the occasional low mood that we have when something bad happens to our life at the course of work, and we feel well the next day. All right. So when you find out you're in the rut and you just stay in that for a long time, maybe it's not just a normal fluctuation in the mood. And you have a loss of motivation and loss of interest in activities that you used to enjoy. So generally, I will start by asking people come to see us, mental health. So what are the usual hobbies that you do to relax and to enjoy? What kind of activities do you like? And have you been doing that recently? And if so, do you still enjoy? Do you find that you enjoy it as much as before, or you just find that you're just going through the motions but not really enjoying that? So somebody who loves to watch television might find that they would tend to stop the show before it ends because they don't find that interesting anymore. They don't even have the motivation to turn on the computer or the television. Somebody who likes social contacts, going out with friends, will find that they are isolating themselves more and more at home. They turn down requests from their friends or family to go out. So there are many kind of instances like this. So some people like fishing, some people like music, some people like social interactions, others like sports. And the frequency, the intensity of doing this is much decreased, primarily because they have no longer any interest in doing this. So, okay, just a slide on hobbies and interests. So you can think about something that they like to recharge, something that they like to enjoy. Most of the time I hear is listening to music, doing sports, being with friends. These are pretty common. So what about sleep? Sleep is affected, obviously, as we know. In people with depressive disorders, generally 3 types of sleep disorders we see. People have problems falling asleep, so they may lie in bed for hours and they just can't drop off to sleep. And the second type of sleep problems is they have a lot of waking up during the night. They call intermittent awakening. So they wake up, very light sleeper, they sleep again. And this is a marked departure from before they are depressed. The third sleep problems that they sometimes see themselves having is early morning awakening. They wake up 2 to 3 hours before their normal wake up time, and they can't fall asleep after that. So obviously, these 3 sleep patterns, sleep dysfunction or sleep problems, were very different from when they are well. Okay, so that's not their normal sleeping pattern, and they feel very, very tired after that the next day. They have problems staying focused and concentrate because the lack of sleep affects the attention and memory span. Depression affects how we see the world too. So how we see ourselves is affected. We feel we are worthless. The work we do is not good. We are burdened to others. We may feel guilty about the past, some things we do. And sometimes we find that these individuals tend to ruminate about things that for most of us, we don't actually spare a second thought. Something that we think is trivial, that we can, but they keep harping on it. I shouldn't have done this, and I feel so bad about it. When the person they thought they have affected doesn't even mind or doesn't even think about it anymore. Other times it's about the future, how they see the future. The future is hopeless. or how they see the world. The world is overly harsh, nobody is helping, and invariably most of us will have this kind of thoughts. But when it is persistently so, and despite sometimes evidence to the opposite, like there are actually people who come to approach them and try to help them, but they still see the world as harsh and unhelpful and unforgiving. So this is maybe an indication that there's something more than just a normal, occasional hopeless feelings of worthless feelings or feelings of guilt, not the kind of transient feelings. Finally, also maybe there's a couple of more symptoms. Energy level, they feel tired. And it's like before the end of the day, their battery is flat, they need to recharge, they had to take a short nap, they can't go on. And because of their tiredness, they didn't do as much activities as they used to, not going out because they want to rest at home, not finishing their work because they need to take a short nap or take a very long sleep during the day. So they report feeling very lethargic, okay, throughout the day, even when they do nothing much physically. This is very common. And concentration is affected. They get very forgetful. So for those of us who had to do tasks like typing, so a little bit of attention problems shows up very obviously. So you type the wrong words, or if you're driving, this attention problems come up very fast. Okay, you pick it up easily. But for those who may have more sedentary type of work, who sit down most of the time, and basically the work may just involve processing people who passes through a certain place. Sometimes attention problems may have been missed. Okay, so usually I will ask, is there things that do you find yourself more forgetful? As in, you tend to misplace things more often, forgot to lock the doors, turn off the lights, turn on the gas, or forgot to bring a wallet when you go out. Do you find that you have more problems making decisions? Because when you can't focus and you can't really weigh the things that you have to decide on, it takes longer to make decisions. You're very indecisive. People will say, how come you can't decide on simple things like what you want to have for your lunch or your dinner? Okay? So it depends on the task you do, and it also depends on what you find yourself in day to day. Appetite is affected. They would usually tell you that they don't eat that much, they miss meals, or they eat half portions instead of full portions like last time. Why? Not because they want to lose weight. So it's important to actually ask them, is it because you want to lose weight? Are they exercising more and that's why they're losing weight? But because when they think about food, they just don't feel hungry to eat it. It's not a conscious choice of losing weight or staying healthy, but it's just really they don't want to take anything at all. And another aspect of depression is everything is slowed down. So the way a person thinks, the way he responds to you is slower. Sometimes there were pauses when he thinks about how to respond to you, and then he slowly responds. The way they walk, the way they move, everything is slowed down. So in psychiatry, we call it psychomotor retardation, or sometimes you can see the opposite when they are very restless. So we call it psychomotor agitation. They feel that life has no meaning, life has no purpose, and it is in some people, you see very unfortunate instances of self-harm or completed suicide. Okay, so this is related to what I said earlier on, where mainly about arousal and performance, sometimes small bits of anxiety. People who have anxiety disorders, sometimes psychosis, sometimes depressive disorders, they also feel anxious. And they find that they are so preoccupied, there's so much preoccupation with I can't cope, I can't manage, I'm going to die, this is going to reflect very badly, this is disastrous, that they are at the right part of the curve where the performance is really very low, it's counterproductive. But small doses of that kind of arousal actually helps you to stay more focused and deliver results. So just to think about physical and mental health, I can't emphasize enough. Sometimes uh, having enough sleep, looking after your body well, eating well, or mindfulness exercise does help mental health greatly, because ultimately the brain works, it is part of the body. You can't really separate mind from the brain, from physical part of us. So just talk a little bit about because of the depression, because this has you give you an idea about what can we use as treatment for depression. So there are psychological factors, social factors, and biological factors. So things around us can affect how we feel. Social factors such as life events, these are the things that happen to us, big things that lead us to having to change the way we think or the way we operate the people around us. There can be positive things like getting married, moving to a new house, or it can be negative things like having a terminal illness or somebody close to us who passes on. So life events, regardless of whether they are positive or negative, they all kind of generate some kind of stress, and obviously some generate a lot of stress. So it's about recognizing the stress early, even the positive life events, and trying to do things to mitigate. Even if it's happy things like preparing for marriage or moving to a new house, it's important to remember about rest, about getting help if you need to. And in the extreme negative life events, obviously you have to think about getting social support and getting help if that is needed. There's a biological basis of depression because we know that the brain can be what we call neurotransmitters. When they are not working well or in the wrong amounts, they can actually lead to low mood and other problems. So the two main neurotransmitters that we identify are norepinephrine and serotonin. And this is the basis for the drugs. For example, Prozac or fluoxetine is a selective serotonin because the reuptake inhibitor, so it improves the access to some of these neurotransmitters to the brain that regulates the mood. And there is a dizzying array of drugs. There's many different kinds of drugs, many different types of drugs, as you can see here. And they may have side effects and they may have different ways of working or effectiveness. But generally, the good news is that because there are different types, even if one doesn't work for us, it's usually good to try another, and eventually there will be a drug that works, which causes the least side effects that matters most to us. Okay, and I've seen that for most people who are treated with antidepressants, they generally do very well if they can find the drug that has the least side effects and then maximize their functioning. So psychological factors we spoke earlier on. There's an experiment. Seligman actually come up with the concept of learned helplessness, where if the dog, no matter what it does, still get a lot of negative stimuli delivered, then suddenly eventually the dog settles into a behavioral pattern that mimics depression. Like not even trying, there's the kind of not moving much, not responding much to the environment, very much like mimics depression. So uncontrollable bad events can lead to a sense of a lack of control and a person stopping even to try to change the situation. So it's kind of related to the concept of the locus of control. If you feel the locus of control is somewhere internal, that you control the consequences of your behavior, generally you will be kind of more motivated in achieving academically or in interpersonal relations, to learn, to exercise, and to smoke less and so on. But you feel that the locus control is beyond us, it's something outside of your control, you'll be more resigned to conditions as they are. So there's a lower efforts to deal with your health problems, the lower levels of adjustment psychologically, and it is just very it can lead to a situation where you feel that others control your destiny instead of you controlling your own destiny. So the ways we think do again, this is on the psychological basis of our moods. The way we think affects the way we feel. We find that we have two different kinds of thinking. Some of the thinking patterns are intuitive, they're very quick, they're instinctive. So this is the automatic way of thinking. We also have kind of a deeper level of processing where it's rational, deliberate, and more self-conscious. Okay, so think about if you see something which is nice and it engenders certain kind of positive emotions, if you have to react very quickly, you just do it and don't think so much. If you are in the reflective mode, you have to spend more time processing and more deliberate thinking is involved. And when there's, let's say, severe turbulence on the plane they are in, certain things automatically kicks in, certain kind of emotions, panic, even though you kind of knew that air travel is generally very, very safe statistically. So it is altogether about choice, but what kind of choice you can exercise in the situations. So I just want to quote from psychiatrist and Holocaust survivor Dr. Victor Frank that he said this: between stimulus and response, there is a space, and in that space is our power to choose our response. In our response lies our growth and our freedom. So regardless of how dire the situation we find ourselves in, if we can adopt that mentality, it does actually means a lot more prognostically. So there are other things that's kind of related to organizational psychology, the Herzberg factors, the motivation factors that increases satisfaction. In this case, it's a job, looking for a job. And they call it hygiene factors. Certain conditions may make you feel more satisfied in your work and affect influences your motivation, like recognition, achievements, responsibility, the work itself, if you're good at it, and advancement potential and personal growth. But there are other things that lead to job dissatisfaction, like the work conditions, like you have to walk half a world away to get a photocopy done, or there's not much space for you to put important things to you when you're working, relationship with your colleagues, your co-workers, the policies which are rigid, and salary and things like that. And then there's another school of thought, Daniel Pink's the book Drive. Generally, we feel more motivated if we have a sense of autonomy, having control over our work. So this is like the locus control that we spoke about earlier on. And we have a sense of mastery in what we do. We are good at what we're doing. We have a sense of purpose. What we're doing is important and relevant to ourselves and to the world. Okay, so sometimes in psychological or psychiatric rehabilitation, we have courses that focus on some of these skills: problem solving, creative thinking, assertive expression, managing emotions, value reasoning, and critical reasoning. So I'm just putting it out there that there's a choice in this young man in choosing how to react because of the situation, and sometimes certain skills may make us being more in control of how we responded. So it's a quote from Reinhold Niebuhr that this is also called the serenity prayer. Grant me the serenity to accept the things I cannot change, and the courage to change the things I can, and the wisdom to know the difference. Okay, so psychologically, there's kind of the basis for psychological interventions like cognitive behavioral therapy. So in CBT, we identify the cognitive distortions that sometimes make it very unhelpful. So inaccurate thoughts, overly negative thinking, that sounds rational, but keeps us feeling bad about ourselves. So you may hear about the phrase cognitive distortion. Sometimes we just focus on the negative, we may magnify the negative aspects of the situation. We personalize this to ourselves. We are the one at fault, and so on. And this keeps us stuck in the rut. Okay, we always feel that no matter what we do, we're not going to make much difference. So usually for psychological interventions, I would always tell our patients that it's really a way to change our frame of thinking. So it's more adaptive and more reflective of the actual situation rather than being overly punishing about ourselves. overly punishing to ourselves because we kind of focus on the negative, which are not realistic, which are not real. So just some examples like filtering, we tend to filter out the negative, we ignore the positive parts, black or white thinking, and overgeneralization. I'm going to move on a little bit quickly because there are some things I want to talk about in terms of self-care and seeking help resources. So this is part of the psychological therapies, mindfulness-based cognitive therapy, something that there's been much research and work about. I do think it does help being more conscious of our emotions and being more able to respond to that positively. So I talked about depression a lot, so this is just a summary. I'm going to skip that. Next, I want to talk about self-care. Okay, it's important we know how to manage adversity better, and all of us, I guess, are still on the learning curve, regardless of what stage of life we found ourselves in. And this is just a quote from Dave Pazer that even in its darkest passages, the heart is unconquerable. It's important that the body survive, but it's more meaningful that the human spirit prevails. So at the heart of it all is actually what we define as the core self and what is really important to us and what we want, how we can make things better for us. So the concept of resilience is really about recognizing that life would always comes with negative events and setbacks, and it's really about picking yourself up and learning from it. That's in a way a path to growth and staying strong and being strong. And you just keep going. And most of the cases, it will involve learning from the adversities. Sometimes we help, sometimes asking for help, but eventually to recover from it and doing better in the things that we are doing. So 5 factors in resilience that hope to share is to have realistic plans. Okay, so as I mentioned earlier on, if the expectation is so high, but we found that what we are really, the current situation is here, you're going to be in a state of dysphoria and kind of a disappointment with yourself and frustration when it is something that you can't really help. So to what extent you can actually help, you can actually control with regards to opportunities. Sometimes you can create that, but sometimes it may be beyond your control. And having a positive frame of mind and having confidence in yourself is important. Okay, so positivity is not the irrational positivity, but just to recognize that no matter how bad the situation is, sometimes they are not there for long. There are ways of getting help. There are people in a similar situation or worse who have found a way of dealing with the situation. So I would say it's not just an irrational positivity, but or rather a realistic appraisal of the situation that nothing is completely 100% and permanently bad. Next is communication and problem-solving skills. It kind of relates to getting help if you need, communicating your distress so that others can sense it. And problem solving, the core aspects are really breaking a big problem into smaller steps, smaller achievable steps that makes it easy to resolve the situation. So that will help to avoid, if you see the problem as huge and insurmountable, you just sink into the role of kind of giving up and not doing anything. So a big problem like a project can start, of course, with getting all the things on the table, calling your friends to arrange for a meeting. But if you just see a problem as this is something I cannot solve, you just be thinking about it but not doing anything about it. So being able to manage strong feelings and emotions are important. So it's more like related to what I call equanimity. Extreme highs, extreme low, extreme anger, extreme sadness. There's a way of dealing with that better, kind of being more centered and being more grounded. It often helps from kind of extremes in how we perceive the situation. And mental health first aid is a concept that generally involves awareness of the situation, how you feel, seeking help you need, and being involved in the process of recovery. Okay, so generally for those who come, besides if we have to prescribe medications, if we have to refer to psychologists for psychological intervention, we also focus a lot about self-care and staying socially connected. So that's be with your friends, be having good times with friends and families, and being involved and participatory in these events. The worry that we have sometimes in people who are depressed or have mental conditions is that sometimes being anxious about in a group leads them to say no to events, and they stay at home and they kind of get rewarded because they don't have to face that kind of anxiety. And the next time around, they said no again, and this leads to a pattern of increasing social isolation. And had they actually agreed to go to such a gathering, such gathering, they may actually find that actually it's not that bad. I learned to deal with the anxiety because I experienced it. I feel that anxiety is not so bad, and conversely, I actually enjoy the interaction with others. So actually like the opportunity to actually look for the positive parts of the interaction that encourage you to do something more. So of course, we talk about mind, the brain, and the body, having a healthy lifestyle, having meaningful pursuits, time to ring-fence time to engage or indulge in your hobbies, uh, being with others. These are very important. So last part is about self-awareness, problem-solving strategies, and managing stress and life uncertainties. So a little story about Anthony Gombli's another place. It was at Cosby Beach at sometime in 2006, I believe, somewhere near Liverpool, I believe. It's actually a set of statues of cars that he made of himself, the artist made himself. That is put at varying points along the coastline, some of them very far out. So during high tide, the statues would be gradually submerged, some of them partially, and some of them almost totally. And with each low tide, again, the statues re-emerge. So I'm not sure whether the artist intended that way, but it's kind of that situation where there are life adversities, and sometimes it may kind of almost drown us, but eventually sometimes things will get better again. And this is a kind of pattern that we see. It's really about recognizing the situation and having an approach and attitude to life that works for us. So I spoke about this, and maybe I would not spend too much time. Problem solving strategies: give yourself time. If you have 6 months to do a project, okay, you feel a different level of stress compared to if you only have 2 weeks, because for the rest of the 5.5 months, you are sitting doing nothing about the project. So time is a function of stress when you have a fixed project to do. Having a positive attitude, breaking out a complex problem into small steps, getting help and resources. You were never alone in doing these things. There may be other people who are interested or willing to help, or it's problem is as relevant to them as to you. And maintaining good physical and mental health as a resource to yourself. Okay, this is a little bit about finding purpose in life. Ikigai is a Japanese concept for a reason for being. Think about what you love to do, what you're good at, what you can be paid for, because money is a part of life, I guess, and what the world needs. And between all this, if you can find as many of these confluent in what you're doing, you probably feel very happy with the state of things and some sense of meaning and purpose in what you do. Okay, the last one is very briefly, it's about seeking help. So we talk about when does it become an illness? When the mood, after you've done all this self-care and despite that, the mood is persistently low, or there's other kind of problem that distress you or make it hard to function and work. Because this is where probably more help would be needed. And in talking about treatment for mental disorders, generally, as you get it from depression, there are biological ways like medications. For some conditions like severe depression or schizophrenia, sometimes electroconvulsive therapy is tried, which is a physical therapy. There are psychological interventions, as you gather. Sometimes psychological techniques approach the way we feel, and using this can help to mitigate the symptoms that we experience. And there are social interventions as well. So that's why you see in hospitals, you may have a social worker who addresses some of this. Can be family therapies, relationship therapies, getting tangible help, financial resources, and so on. So a little bit about barriers to treatment. What worries me is that despite requiring help, some people are not seeking help because they may either feel that I'm not sick, I'm not mad, I'm just tired, or it's too troublesome, too far away, I'm just too busy to do what I do. Remember, if you're depressed and you're just functioning at 50% productivity, you're just floundering. But maybe it doesn't have to be like that. Maybe if it's treated, you can be much more productive and spending less time doing work things and more time doing things for yourself. So at other times, I hear stories, patients telling me, "Can you tell my family that it's not something I can just snap out of it or don't think about it? I can have very depressive thoughts. The parent will come to me and say, just stop thinking about it and you'll be okay." So it's not that easy kind of switch. Or sometimes the family members will feel that the patient is being difficult or just being weak. So remember we talked about earlier on that sometimes there's a biological basis. Sometimes it's actually the brain chemicals that are dysfunctional, and it's not a matter of willpower to correct that dysfunctions in the brain. And that aspect is stigma, the stigma of seeking help. Stigma and discrimination, this is from Professor Norman Sartorius, who is a prominent psychiatrist. He says that stigma and discrimination because of mental illness are not only among the worst consequences of mental illness, but also among the greatest obstacles to providing care and support to people with mental illness and their families. So it is sad when you see people not coming forward when they need the help and just struggle in silence and affecting themselves and their families a lot too. So talking about mind, body, and brain. So back to what we talked about self-care, eating healthy. So sometimes what we eat also is how we feel. So if you eat healthy, you generally have a better sense of well-being. Having regular exercises help because we know that exercises produces the endorphins or happy chemicals in the brain. It leads you to have a positive, very good self-image. You feel fit and you're less pricked by the body discomfort and don't feel depressed as often. Interacting with family and friends are very important. Looking at the mind is very important too. As Eric has done earlier before this talk in doing mindfulness exercises, having time for your hobbies, doing things that you like are also important. So the last 2 minutes is really about this is a resource that is, I thought it's an excellent resource done by IMH chat case managers. So they kind of compile the different kinds of help resources available in our society, dividing it by face-to-face consultations, phones or helplines that people can call, or even virtual platforms like live chat with somebody on a device, or even a help bot. It's kind of artificial intelligence responding to the situation and then linking it to help if certain responses come up. It can be also divided by children, by different demographics, children, youth, seniors, families, and parents as well, and at the workplace. Actually, I'm going to have a few slides on that. So if you think this is something relevant or important or useful, you can actually download the resource from Singapore Psychiatric Association website. Okay. For example, in the mental health resource, the agencies that provide face-to-face counseling. So you can see a few of these agencies who are doing that. In the extreme left, a short description of what they do and ways of kind of accessing these kind of services. Give me a website that can provide more information. Okay, so there is a Caregiver Alliance Limited for those caregivers who are to support people with mental health conditions. Care Corner Counseling does a lot of counseling services in the community. IMH, the chat, this is a very useful resource for youth who have mental health issues, and the Singapore Association for Mental Health as well. Club Hill is more specific to cater to the mental health needs of Muslims, but of course they will welcome all individuals regardless of race or religion. So it's kind of maybe more specific in different areas here. phone or helpline. So there are some of the numbers that collated for people who needs it, and when they operate, and certain specific segments of the population here. Okay, what National Care Hotline, SOS. So these are the usual resources that you find in our Straits Times when unfortunate incidents happen, by kind of collation. And virtual platforms, for example, live chat. For the young, sometimes for the youth, they may sometimes find the physical face-to-face encounter a little bit intimidating, and some of them might prefer just usually finding out what's the problem to do something more discreetly, like from a distance, either through chat, live chat, or email. Or it may actually help to try out some of this. It may be a live chat or a help bot. What I thought was very promising was MyLine. It's actually a kind of a resource by MOH technological branch or department. It has a resource and also a help bot. It can respond, tell them what kind of issue that you're facing, and then the kind of AI algorithm that responds in kind as well, and linking out with the services if they think there's a need. And then, of course, segmentation by population, children, youth, and all that. So finally, in the SBA website also, we also have links to the hospitals offering psychiatric services. We updated it recently to include some of the hospitals that we didn't include the last time around. So essentially, most of the general hospitals have a psychiatric department that can offer psychiatric services and treatment. They can include either medications or psychological interventions. So you see the links, how to access the care, a short description of their services, and the opening hours of the clinics.